Thank you, Aki. Good morning, everyone. So I'll discuss how we can optimize thrombus removal for thrombus extending into the IVC. These are my disclosures. And this is a case that had multiple interventions, so several of my partners were involved in these interventions. So we have this 23-year-old white obese female who has worsening left leg pain and swelling. She actually has inability to walk and shortness of breath over the past 7 days. She has a history of DVT and pulmonary embolism. She has not been compliant with anticoagulation, and she has antithrombin 3 deficiency. She is admitted, pulmonary embolism is diagnosed, and left leg DVT. Her shortness of breath resolved with heparin, but her left leg pain swelling was persistent. She had purple discoloration and weakness of her leg. So we decided to proceed with an intervention. Patient in prone position, popliteal access, you can see the thrombus. An IVC filter was placed, and ultrasound-assisted thrombolysis was initiated. Next day, things are a little better. We go on with pharmacomechanical thrombolysis. Thrombus clears. There is an underlying left iliac vein lesion. I place a stent, 1690, wall stent. Things look good. Symptoms resolved that the patient was discharged on Pradaxa, only to return back a week later with recurrent unbearable left leg pain and swelling and inability again to walk. CT venogram reveals the stent thrombosed. Again, back to the operating room, popliteal vein access and initiation again of ultrasound-assisted thrombolysis. You can see the clot going all the way up to the filter. Things look a little better the next day. The stent has started clearing out. My partner decided to use the CAT8 thrombectomy device. Things cleared up pretty well. The stent is now reopened, and the left leg now feels better. By the next day, the edema has decreased, but now she developed right leg pain and swelling. So she has now right leg DVT. Again, back to the operating room, initiation of thrombolysis. A Craig-McNamara catheter is placed throughout the clot. Next day, things look a little better, but still there is clot. Angiojet again, balloon maceration, still clot in the stent, still clot in the filter. Well, this is the case that you need to escalate treatment to something more powerful. And when you're looking for powerful suction thrombectomy, the angiovac is the most powerful system we currently have to aspirate large particles of clot. The angiovac system consists of the angiovac cannula and the angiovac circuit. It's an extracorporeal circulation practically with the filter in between to hold the clot. It comes in two configurations. You have the straight tip cannula, 22 French, and an angle tip 20 degrees that will facilitate the cannula to navigate into the side branches. The whole system moves over a stiff wire, and it has a funnel tip that is inflated and can open up to 26 French to accommodate the entire IVC. We obtain access bilaterally through the IJs. A 26 French sheath on the right IJ, the reinfusion cannula, 16 French through the left IJ, and bilateral femoral access that would facilitate navigation of the cannula through and through access into the iliac veins. And here is the venogram through the pigtail coming from the right IJ. We attempted to retrieve the filter. It didn't seem to be that easy, but at this point we were ready to initiate the angiovac, so we decided to leave the filter retrieval for later and not engage in a complex retrieval. You can see here the cannula carefully navigated aside of the filter and thrombectomizing the clot, and then navigating the cannula down to the right iliac vein, subsequently cannulating the left iliac stent, and this is the way we can navigate the cannula to the left with the balloon wedged inside the tip to navigate it down to the left iliac vein. And this is the end result. Bilateral iliac veins and the stent appear to be clear, and the clot in the IVC is mostly gone, with some left behind on the filter. This is the clot that was removed. The filter was removed then a few days later, and it was actually not that difficult. 1 month follow-up, the IVC is patent. Thank you for your attention.